You or a member of your family will be about to commence a course of chemotherapy treatment. We recognise that this is a period of time which can cause some anxieties. You may have some concerns or you may have some questions that require answering before you commence your chemotherapy treatment. You will have been given a pack containing some information that you will need throughout the course of your chemotherapy. Within the pack, you will have some information that's specific to yourself. However, everybody will be given a patient-held diary, which is the red book, and in that will be 24-hour contact telephone numbers for who you contact if you have any concerns whilst on the treatment. You will also be given an alert card, and this contains some signs and symptoms that will require reporting whilst you're on your chemotherapy treatment. Throughout the course of this DVD, you will be given some information from health professionals, as well as some patient information from other patients that have experienced treatment, and you may find this information useful. You will also have a checklist in which you can make notes throughout the course of this DVD, or if you require any specific information pertinent to yourselves, you can make notes on this. After the DVD, you will be given the opportunity to discuss any issues or to raise any further concerns with your chemotherapy nurse.
Chemotherapy is the use of anti-cancer drugs to destroy cancer cells. There are different groups of anti-cancer drugs that can be used, depending on your individual diagnosis. There are many types of chemotherapy drugs. Some can be given on their own, but often two or more are given together as a combination. The type of chemotherapy that you're going to get will depend on different things, including what type of cancer you have, where the cancer is in your body, what the cancer cells look like under a microscope, and whether the cancer is spread to anywhere else in the body. The drugs you're going to receive will be discussed with you by your oncology consultant. There are a number of ways that chemotherapy can be given. The most common ways are into a vein, which is called intravenous chemotherapy, or as tablets, which is known as oral chemotherapy. If you are going to be having intravenous chemotherapy, usually you will have a needle inserted into the back of your hand, and then this will be removed at the end of each treatment. Sometimes you may have to have a central line put in. This goes into a vein, either into your arm or into your chest. This may be used depending on the kind of drugs that you're going to have, or if nurses find it difficult getting needles into the back of your hand. Sometimes it may even be useful even if you don't like needles. Chemotherapy is usually given as a day case. You'll be sat in a comfortable chair, you'll be provided with tea and coffee and sandwiches, biscuits. If you want to bring along anything like a book or newspaper, magazines, MP3s, anything like that which will help you pass the time of day, it's a good idea. Please make sure that you have something to eat before you come, eat and drink normally, and take your usual medications that you would take on a daily basis, unless you've been told otherwise by your consultant or your nurse. Chemotherapy can stop cancer cells dividing and reproducing. The drugs are carried in the bloodstream and therefore can reach cancer cells anywhere in the body. Chemotherapy is usually given as a series of treatments. Each treatment is then followed by a rest period. The chemotherapy and the rest period is known as a cycle of chemotherapy. Each cycle of chemotherapy aims to destroy more of the cancer cells, and the rest period allows your normal cells and tissues to repair and recover. So before you start your treatment, there'll be a few things that need to be done. First of all, you'll have to have your height measured and you'll be weighed. This is to make sure that you have the correct dose of chemotherapy for you. You will be seen by your doctor and your nurse, and your individual treatment plan will be discussed with you. They'll go through any side effects that may be caused by the chemotherapy, and then also make sure that you've got contact details for both in normal working hours and out of hours if you have any problems at all. You will also need some routine tests before you start your treatment. These will include a blood test, a routine MRSA screen. Sometimes you might need a urine test or a heart test, but these will be arranged with you at your clinic appointment and discussed further if you need to. It's a good idea to bring somebody with you to your clinic appointment and when your nurse goes through your treatment plan. This is mainly for moral support, but also to listen to the information, and it's also a good opportunity to ask any questions that you might have. Before you leave the hospital following your treatment, you will be given some anti-sickness medications to take with you. Your nurse will explain to you when you need to take these. You will also be given an appointment for your next cycle of chemotherapy, and you will need to see your consultant before you have this treatment. You will need to get your bloods checked before you have your next chemotherapy. This can either be done at your GP surgery or at the hospital, depending on whatever's easiest for you. You may receive a phone call from one of the chemo nurses the following day after your first cycle of chemotherapy just to check you're okay. And don't forget to call the 24-hour helpline if you have any problems at all.
Once a decision to treat with chemotherapy has been made, your team of doctors and nurses will give you both written and verbal information regarding the specific drugs that you will receive. It's very important to realise that there are many different types of drugs with different side effects given for many different cancers. Therefore, different people will tolerate these drugs in different ways. Prior to starting your chemotherapy treatment, you will be given a chemotherapy red book. This is a record of your treatment. If you bring this with you to each chemotherapy appointment, the nurses will record important information regarding specific drugs you've been given, your most recent blood results, and which drugs you'll be given to take home with you. In this red book, you'll find important information that will guide both health professionals and yourself in observing signs and symptoms of infection and who to contact should this occur. When you receive chemotherapy, your ability to fight infection may seriously be reduced. It is therefore very important that if you develop any signs or symptoms of infection, that you seek medical advice immediately. Signs and symptoms of infection may be very obvious to you. You may develop a sore throat or pain or burning when passing water, but sometimes infection may not present quite so obviously. You may feel shivery or shaky. We recommend that you have a thermometer at home whilst on chemotherapy. If you feel unwell at any point, please check your temperature. If your temperature is 37.5, wait an hour and then recheck it. If it is still 37.5 or above, please contact your hospital team immediately. If your temperature is 38 degrees on the first reading, please contact them at this point. You will be given an alert card at the start of your treatment. This card we ask you to carry with you. In the event of you feeling unwell with a high temperature or signs and symptoms of infection, please show this to any health professional that may be making a decision in your care throughout this period. It's really important that you remain well throughout your treatment. There are things to avoid, for example, anyone with an obvious infection, and things that you can do to help yourself prevent infections, for example, washing fruit and vegetables before you eat them. Always wash your hands before you prepare and eat food. Probably things that you already do, just being a little more vigilant whilst you're going through your treatment. All the advice that you will receive from your hospital team will be around trying to reduce your risks of infection during your chemotherapy period. And you'll find a list of these do's and don'ts within your chemotherapy red book. It's also essential to take good care of your mouth whilst you're receiving chemotherapy treatment. We recommend brushing your teeth after meals and before bed with a soft toothbrush and rinsing your mouth with water or a mouthwash for approximately 1 minute. Each day get used to having a look in your mouth to see if any signs of either mouth ulcers or oral thrush. It's really important to seek medical advice should you notice any of these signs and symptoms. Some chemotherapy drugs may make you feel sick. In order to prevent this before it starts, you may be given anti-sickness drugs via the drip and tablets to take home with you following chemotherapy. Your nurse will explain how and when to take these tablets. Should you feel sick or actually be sick following your chemotherapy, please seek medical advice. You may notice a change in your bowels following chemotherapy. Some people experience constipation or diarrhoea or both. It's crucial that you contact your hospital team for advice in order to rule out infection, prevent dehydration or alleviate symptoms. Hair loss or hair thinning may occur with some chemotherapy drugs, but not all. Your team will discuss this with you in order to prepare yourself if hair loss is to occur. You'll be given a wig referral and instructions on how and where to obtain this from. Chemotherapy doesn't mean that you can't have sex, although you may not feel like it. However, it is vital that you don't become pregnant or father a child during your chemotherapy treatment plan. You should continue to use contraceptives to prevent this from occurring. It's really important to try and maintain as much normality within your life whilst having chemotherapy, but without being at risk of infection. If you're planning a holiday or a trip away, discuss this with your hospital team and we may try to fit in with your plans or advise you not to travel. Please do not hesitate to seek medical advice should you feel unwell at any point during your treatment plan. Your team will give you emergency contact details which you will find in your red chemotherapy book. Please do not hesitate to use them.
There is no specific financial support for cancer patients. However, there are benefits such as disability living allowance and attendance allowance, dependent on the individual circumstances. The information for these benefits can be obtained from the Cancer Information Office at your local hospital and also at your local council. There are hardship grants which can be available from Macmillan, and the information for these can be given through your cancer nurse specialist. Free prescriptions are available for all cancer patients on active treatment. The claim forms for these can be gained from the GP surgery, outpatient department and pharmacies. Free car parking may be available at your treatment centre. Please ask at the chemotherapy reception for further details. A key worker is someone who will support you through each stage of your treatment. For chemotherapy, this person will be identified on your first appointment.
Chemotherapy can be difficult, however, you can get through it. And here are a couple of patients' experiences.
Before I started my chemotherapy, I was worried about the side effects, how I would be, would I get back to my normal self, painting, decorating, gardening, walking, and nothing has changed. I've been so good on it, so I would say to other people, just take each day as it comes.
My main concerns before starting my treatment was hair loss, sickness. I'd seen, telling people, how ill they were. But now I'm quite happy with it, yeah, it's good. My experience of chemotherapy has been brilliant, absolutely, and I would tell other people, don't listen to fairy tales that you're going to be sick, you're not going to have no fingernails, you're going to have no toenails. All right, you may have no hair, but that isn't your eyes, that isn't your hands, that isn't anything, you can still carry on, right? And the chemo, I have no taste buds sometimes, but they come back. My fingernails are brilliant, my toenails are brilliant. It doesn't change it a lot. I think it's how you go to it as well, how your attitude goes to it as well. If you're going to sit down and think, oh, I'm going to be sick, then you will be sick. But if you think, I'm going to be well, then you will be well, and that's the way, the right attitude to be. My experience of coming in for my chemotherapy is that you're made feel welcome, and the nurses talk to you, they put your mind at ease, and you sat in a comfortable place with people who's got the same illness. I don't feel, when I've been, I feel relaxed when I've come, and when I'm going home I feel relaxed as well. The experience is not as frightening as you first think. Chemotherapy has not affected my lifestyle, and
and other people should think the same way, that it isn't going to affect them. Just carry on as normal. Put your eye makeup on in the morning, or you shower, put the scents on, go around the stores and look at all the clothes that the other ladies are wearing. Just as normal. I just say keep your chin up and you'll get through.
The impact that it's had on me is I look at life different now. You don't take everything for granted like I was. I've started exercising, so I have a routine during the day. In the morning we go out for walks. I've put the weight back on. The main thing is I can't stop eating anymore. So, but no, it's changed. It's changed my outlook on life. More positive. But yeah, I'm feeling better now. Feeling 100% better than when I first started. Life's worth living.
Everybody's experience of cancer and its treatment is different. If you are struggling with physical or psychological symptoms, please contact your key worker or your chemotherapy nurse using the contact numbers that you have been given, as there are many things that we can do to help.
You've now heard all of the information, and you may find that you have some questions that you want answered. The best person to ask this is the nurse who will come in to speak to you shortly. Also, throughout your treatment, you may find at various points during that treatment, you may have other questions that you want answered. And again, the best person to ask is your chemotherapy nurse. There are further resources available to yourselves. For example, some hospital sites have local cancer information centres. However, if this is not available to yourself, again, speak to your chemotherapy nurse. And finally, here are a few websites you may find helpful.